and I've just come in to do your shift assessment. We'll just ask you some questions, and I'll listen to you and look over and take me just a few minutes, okay?
Okay.
Can you tell me where you are?
From hospital.
Can you tell me your name?
Stacy.
And can you tell me what day it is?
October 13th.
Okay. So the patient is alert and oriented. The speech is clear. The tone and pace are normal. Abnormalities would be if the speech was slurred or garbled, too rapid or disorganized thoughts. And if the patient was lethargic rather than alert, they'd respond to loud speech and be able to answer questions but then go back to sleep. An attended patient would open their eyes when they were gently shaken and respond slowly to questions and then not have a whole lot of interest in the environment. A patient in a stupor would arouse to painful stimuli. They'd be able to answer questions, would be somewhat disoriented, and they would become unresponsive once the stimulus was removed. A patient in a coma wouldn't be arousable even to a painful stimuli. That would be like a sternal rub.
Okay.
Eyes would remain closed as if they were asleep. And we just need to look at your skin and take your temperature. First I'll take your temperature with the thermometer, and then I'll look to see if you have any unusual moles or anything like that, okay?
Okay.
Alright, this just go across your forehead. Alright, temperature is 98.2, and that's normal. Temporal temperature or across your forehead is 97.4 to 100.3 is normal. And then I'm just going to feel your skin temperature with the backs of my hands on your arms. And the skin feels a normal temperature, and it's pink and warm and dry. And I'll just take a quick look here. There are no wounds or lesions. There are a few scattered moles, but they're all smaller than 6 millimeters. And we'll look at your legs. Okay. The skin is normal and pink and dry. If there were unusual moles, I would want to look at the border for something that was ragged or notched, and look to see if they were symmetrical from one side to the other, if the color was variegated or different colors within the same mole, or if there was bleeding or soreness. Those would all be causes for concern. And as far as your skin color, it's nice and pink. There's no pallor, which is paleness that can be from anemia or arterial occlusion. And there's no cyanosis, which would be blueness around your lips, or your fingernails, or your hands, or of your feet. And this can be cut because of something like being cold in the exam room or anxiety. But if it's central cyanosis around your lips, that can be saying that you're having problems with the low oxygen level. And there's no yellowing of your eyes. Yellowing of your eyes is called jaundice, and that can be caused by blood cells being broken down too quickly. And I'm just going to take a look in your eyes with my light, okay?
Okay.
I'll shine into each light. I'll just have you to look straight ahead as I'm shining into your eyes. Don't look at the light, look at my finger, okay?
Okay.
Okay, look at my finger. Alright. I'm shining in your eyes. Keep looking at my finger here. Okay. Very good. So the pupils are 2 millimeters, and that's a normal size. And they both react to light both directly and indirectly, and that's called consensual. When I shine the light into your eye, that pupil gets smaller, and when I shine the light into the eye, the opposite pupil also gets smaller. And the accommodation of your eyes, if that's increased convexity of your lens when you look from far to near so that you can focus, but that's not something that I could be able to see when I was just looking at you, okay?
Okay.